What are federal grants and aid for states? Have you ever wondered how states fund essential services like education, health care, and infrastructure? One key player in this financial support system is federal grants and aid. These are funds transferred from the federal government to state governments, aimed at supporting specific public programs or policy goals. But what does this really mean for states and their residents? Federal grants and aid come with specific conditions on how the money can be used. This ensures that the funds align with federal priorities while helping states manage various functions. At their core, these grants are a way for the federal government to distribute money to states for vital services. This includes areas like health care, education, social welfare, and community development. There are several types of federal grants and aid that states can receive. First, we have categorical grants. These are very specific and are meant for particular programs. For example, a state might receive a grant to build a senior citizen center or fund a health initiative. States have limited flexibility with these funds since they must follow detailed federal guidelines. Next, we have block grants. These grants give states more freedom to decide how to use the funds. They are allocated for broader areas like community development or health services. While there are still general purposes for these funds, states can determine the best way to allocate them to meet local needs. Another type is general purpose grants. These provide states with unrestricted funding that can be used for any government purpose. This gives states the most flexibility in how they spend the money. The way these federal grants are distributed can vary. Some are allocated through formulas based on factors like population or need. Others are competitive project grants, where states submit proposals and are awarded funds based on merit. From a policy perspective, these grants are important because they influence state budgets and priorities. Many states relying on these funds to supplement their own resources. This support allows them to provide services that might otherwise be too costly. However, the conditions tied to these grants can impact state autonomy. States often have to comply with federal standards and reporting requirements. In practice, states use federal grants and aid to address a wide range of issues. This includes funding for Medicaid, which provides health care for low-income individuals, education funding, and transportation infrastructure. The relationship between federal conditions and state discretion shapes how these programs work and how state laws adapt to federal requirements. Federal grants and aid for states are designed to support public programs while ensuring that federal objectives are met. They play a significant role in intergovernmental relations, balancing the needs of the federal government with the flexibility states requiring to serve their residents effectively.